So for me, I work with, in the collegiate setting, I work with a lot of soccer players, and over the years, I work with a lot of soccer players. And my thought process is, and obviously tell me if I'm off base, is I have a lot of athletes that are really extended, super extended. They have that, a lot of compensations going on. However, they're your best athletes. And my thought process is, now some of them definitely, get low back pain, get hamstring pain, but a lot of them, don't have pain. And I look at it and say, when I see an athlete walk in like that and they're a PEC or they're super extended, to me, like right off the bat, those athletes are just, they're fast, they're explosive. If they're not in any kind of pain, like, would you try to, adjust any of this compensation, just kind of let them roll?
I'm glad you asked that question. I have actually 3 or 4 slides on that within this presentation. So I'm going to wait to give most of the details before that, but
perfect.
I will answer your question. And I will say that if they have no injuries and they display some red flags, but they're like an exceptionally good athlete, I'm actually probably not going to do a single thing, because like they're leveraging their compensation to be a good athlete. And gotcha. I would honestly, I don't have a ton of experience working with, really high level athletes, you know what I mean? So I would be honestly more weary of doing that, because I might change something and then they could become a worse athlete. Whereas I could leave things be, and if they're on their way to wherever they want to be after they leave your program, then I think just keep letting them do that. You know what I mean?
Gotcha. I appreciate it. Thank you.
Yeah. Perry, you have a question? I see you raising your hand a little bit. You can unmute yourself if you want.
Oh yeah. Can you hear me now?
Yeah.
All right. So I got a question, because I'm always treat like typical female under 50s and with multiple pregnancies. So, they have been a long way ago about that. And I'm questioning myself if they change their ISA angle because of the pregnancy. I mean, if they were narrow because of the pregnancy, they become wider because of this anterior pelvic tilt, or maybe it's just a secondary compensation and they don't change at all. I mean, I don't know.
Yeah. I hate to call that a compensation, because that's just what happens with, life. So I guess it is under the technical strict definition, they are changing what their morphology is, and therefore their movement's changing, and therefore they might have different types of restrictions. So I would call that like pregnancy is technically a compensation. I never thought about it like that before, but I guess that's technically true. So yeah, I do know what you mean though. And when I was working with a bunch of military wives, I saw this all the time. So they would get pregnant and then their ISA changes, and then it's like, well, what do you call that? I think you just meet them where they're at. So if they started off as a super narrow person, but I don't know, they had, pregnancy that really widened them out, then I'm going to treat them like whatever they present at that moment. So if they're more wide at that point, but I know they started off narrow, then I'm going to try and get them back to what they were in their original self. You know what I mean?
Okay.
Mm-hmm.
Okay.
But I'm going to meet them where they are.
And also because of this question, I raised another one, and it's okay. So if narrow females have descended pelvic floors, could it be associated to hypotonism or hypertonism?
Can you say that one more time?
If they are wide,
mm-hmm.
And no, I just say if they are narrow, they should have a very descended pelvic floor, right?
Right.
But I don't know if that would mean also that they have an hypotonic pelvic floor. I mean, lack of tone. Or if they are wide, then they could have an hypertonic pelvic floor, because that's gonna matter me, especially because I cannot. I'm not a physiotherapist. I'm well, we call ourselves here as physical educators, but it's like, okay, personal trainer, strength and conditioning, whatever. And I cannot explore them, I'm not gonna put my fingers on there. So how can I figure out if they are hypertonic, hypotonic, basing myself on their ISA position, or maybe deducting from the ISA, deducting the IPA.
Yeah, I think I totally see where you're coming from, and thinking of pregnancy like it's its own sort of thing, because it is. But let me grab my pelvic model, wherever it may be.
See,
Well, I actually don't really know where my pelvis is right now, but hang on. Oh, I do know actually where it is.
I'm on a cafeteria and they are squeezing something, so it's like I'm almost deaf.
Yeah, no, I know what you mean. So it's no different than just do your assessment. You know what I mean? So let's say, I mean, your question is, are they here or are they here more so? And then obviously it's going to depend, you know, like what was their pregnancy? Did they have a C-section, things like that. So if, let's say they have their pregnancy, they're going to have probably more of a descended pelvic floor like this, because all this stuff is stretched out after the pregnancy. Then they're probably going to be able to get into positions that allow for this to happen. So they might be able to squat deep, or they might be able to get a lot of hip flexion. But on things that require compression of the pelvis, maybe their straight leg raise isn't very good. Or maybe things that require them to nutate properly aren't going to really show up as past tests. So my assessment process wouldn't really change, because the body is the body. So just because they had a pregnancy doesn't still mean they're going to, for example, be able to nutate their sacrum and get into internal rotation on that hip. You know what I mean? They're still a person and they still have those muscles. The orientation has just changed. That's why I would say just meet them where they are and then simply get them back to where they should be.
Okay, I will try.
Yeah, so just I would say follow the assessment process. Just follow the exact same assessment, and then that'll take care. And then what we'll talk about today is what we do with that assessment. And I think if you use those same approach, just treat them like a human, I think you'll be okay.
All right. Thank you very much.
Anything else?
Todo bien. Oy.
All right, let's get rocking and rolling. So I'm just gonna mute. So this week is week 6. So I guess after today, we'll be halfway through. That's kind of cool. But today, it's gonna be a lot of exercises, So we're gonna be not getting up a lot until the end. I'll let you guys pick a couple you wanna go through, but there's probably 2 or 3 I definitely really wanna go through with you guys. So today we're just gonna go over what do you do? So you have the assessment. Now, how do we go about picking positions, picking muscular orientations, and picking specific progressions for an individual depending on where they're starting? Hang on, let's let me get a sip of water. My mouth was very dry. Okay, we're going to implement the principles for Corrective for basically creating our own exercises. I'm providing you guys a bunch of stuff because I know that, you know, if I was doing this, if I was going through this program, I would really struggle to come up with things right off the bat. So I would want something to really follow along with that first, and then you can get creative from there. And then we're going to talk about just at the end briefly, what do you tell people after they leave and say like, hey, this is how you stay in your pattern. This is how you keep these adaptations that we're getting through these exercises. And then next week, we're going to talk about weight room stuff. Week after that, more plyos, core, athletic development type stuff. So the first thing I want to cover is just the basic positions and what they entail and when I would pick one over another one. So the first thing is the stack. I think we have all heard this word before. So the stack just means that your diaphragms are stacked. So you have your pelvic diaphragm directly underneath your thoracic diaphragm. You can tell that on that image on the left. If I was in an anterior pelvic tilt, then we're not going to have that stack, and respiratory function is going to be limited because as we inhale, these diaphragms need to synchronously descend, and as we exhale, they need to ascend. I almost got that wrong. That would have been bad. So we need this stack, and they need to be able to maintain this stack throughout exercise or throughout really anything that's not, let's say, you know, a primary or secondary lift, depending on the individual that you're working with. But on all these corrective exercises, yeah, we definitely want to go after this. The stack generally entails something like a posterior pelvic tilt because most people are starting from a place of extension. If you're standing or if you're just laying down, usually it includes some sort of knee bend, and there's rib cage retraction also usually involved with that. Now, the untrained eye can look at this position right here and they would say, well, that person's slouching. There's a difference between stacking and slouching, and I make sure all my clients understand this difference. So what I will say, I will cue it by saying, I want you to stand tall, toes straight ahead, feet hip width apart, unlock your knees, and then push your ribs back without losing an inch of height within your skeleton. So I can do that, or I can do that. And there's a big difference between those two things. The second one depresses the sternum and is going to prevent airflow from going into the anterior rib cage, and also throw off the mechanics of the posterior rib cage too. So the basic positions, basically, the more stuff your body is touching, the safer the exercise is. So the more stuff we get people touching at the beginning, then probably the more success we're going to have because there's more references. There's less degrees of freedom, if you want to think about it like that. So the first two positions are 90-90 positions, but gravity is a massively influential factor that I don't think people think about enough. Just by changing the position of your torso and pelvis relative to the floor, it totally changes the exercise. So for example, this 90-90 right here, the supine one, that is going to be compressing me like a pancake because gravity is acting down. And we're not really too concerned about gravity day to day because, we're designed to, work with it. But when we're just laying on the ground, we're actually, those forces are acting on us differently than standing. So we're going to get anterior rib cage compression, but then posterior expansion. You might ask, well, if my back is against the ground, why would I get posterior expansion? Well, it's because it's no different than this cup of water right here. Everything's going down. The viscera and all the guts are pushing down. So that's going to allow for expansion to occur. And in this position, you can still feel that posterior expansion. It's not like there's no way the back is going to expand just because it's touching something. Generally speaking, with the posterior pelvic tilt, you're going to get your stack and then the expansion will happen naturally because gravity is so important. Side lying is just the opposite. It would be lateral compression. So we would get anterior to posterior expansion. And we're also going to get more of this nutation bias within our sacrum, regardless of whether we are supine or sideline. So it's relative nutation because we're tucking, right? So it's not like we're going into like total nutation extension. It's just more relative than something like this quadruped rock back. Quadruped is fantastic because gravity. So gravity is pushing down, which is going to expand our anterior rib cage. And then we're also, because of the angle of the reach, 90 degrees. So we're going to be getting even more anterior expansion bias. So that image on the left right here is an example of just quadruped breathing. Now, again, because I'm in 90 degrees of hip flexion, that's another nutation bias. If I were to go deeper into hip flexion, like on the right, that'd be more counter nutation bias. Hook lying is a great position to really get someone to feel some hamstrings in. It's a good position to re-educate hip extension. And then you also have this hemi 90-90 position right here. And this is just sort of this crossed between nutation and IR on the back leg and hip extension. And then on the front leg, we're going to have more ER, counter nutation bias. Short seated is really good for those people who need to basically just learn how to stack passively. I wouldn't use any more elevation than this right here because really we want them deep in hip flexion. So honestly, I'm kind of the upper limit of when I would start to re-access that counter nutation. And in this short seated position, the most important thing across the board is, are they feeling their sit bones, their butt bones? So those are the bony protrusions, your ischial tuberosities in each butt cheek. If they're not feeling those, then they're probably not stacked. They're probably rounding too much. And then inversion. Inversion, I don't have a cap on this water, but imagine that I flipped it upside down. All of the air and the pressure and the gas would want to go down. Because if I took a breath of air in that position right there, what would happen is my lungs would fill from top to bottom as opposed to like right now from bottom to top because of gravity. The last two right here are standing supported. This depends on the level of hip flexion that you're in. It's so hard for me to say like, this is what this is, but if you're in 90 degrees of hip flexion, it's going to be more IR bias. If you're, in that 0 to 60, more ER bias. And then if you're in a split staggered stance and you do a hip shift, it's the same exact thing. If you hip shift from 0 to 60, it's going to be more ER bias. If you hip shift in 60 to 120, it's going to be more IR bias. And then there's not really hip flexion past 120 degrees. We know that, but I was just trying to complete the Lemark model there. Okay, so I kind of touched on all this stuff within those couple of positions right there, but this is your menu. If you go to a restaurant and you're gonna order something and you got like a create your own, this is basically what this is. So these are all the things I'm considering at all times when I am thinking about picking a corrective or like a reset drill. I don't really like, and I talk about this later, but I'm just getting it out of the way now. I don't like the term corrective exercise. I think it implies to the person that they're broken and they need to be corrected. And that can be a slippery slope, but I use it with you guys because you're coaches and I think we all can understand what that term means. So I think it's okay to use it. It just depends on who we're speaking to and how we use it. So Lemark model, I think we touched on that in the last slide. Gravity, huge. That's basically the biggest point I made. And then references of the foot. We're going to get into this much more next week. And there will be a couple of exercises that you look at today and just be like, I don't really understand that, but wait until next week. And then we're going to be able to talk about these positions in a lot more detail with references. And then compensations. We want to remove the layer of compensation than the underlying pattern, because we have these deeper muscles that are more our base layer compensations. And then we recruit bigger muscles on top of that. Okay, now for the fun stuff. The first thing we do, regardless of who we're working with, is we restore expansion first. So when I first started off doing this stuff, I actually used to try to restore internal rotation to wides if they should have it first in their pelvis, and it didn't really work very well because it just compressed them more and they weren't ready for it. So I think going external rotation, counter nutation in the pelvis first is a really good argument to make because of a couple of things. We're just biased towards external rotation a lot more as humans, but also there's an argument to be made in terms of our evolution and how we started off. Most of the things we evolved from are very external rotation biased in nature. So internal rotation helps us produce force, but it also compresses us because our compensations are exhalation strategies, if you remember. So if we're exhaling as a basically compensation strategy, we probably want to restore more inhalation mechanics. So regardless of who we're working with, I'm going to try and get them more of this counter nutation first with very, very few rare exceptions. Assuming that they do have limitations in this. Within their rib cage, it's a little bit different. With a wide, I want them to look more like they should, which is anterior expansion, and a narrow posterior expansion. So if they're missing either of those two things in any sort of degree at all, I'm going to fix those first. So the goals, and I would know to move on from this phase when I see the following things. And this is all going to be relative to the left AIC. So for the wide, I want them to get 70 degrees of internal rotation. Now, the right's probably always going to be a little bit worse than the left. So if I'm at like 60 right, 70 left, I'm going to call it good and move on. The narrow is going to be the same way. If they get, let's say, 90 degrees on their right, but 80 on their left, I'm probably not going to be too worried. I'm going to move on. And then the active knee to chest, the narrows are always going to be better than the wides at this because they're just biased towards it, but we want 120 degrees on both sides, with the left being better than the right. The squat, they should both be able to squat comfortably below parallel. Wides are going to struggle more than narrows. Narrows should get somewhere around, I would say, butt to about mid shin, and wides definitely just maybe about 100 degrees of hip flexion comfortably. They should be able to hold it. And then finally, shoulder flexion, the right will be better than the left, but we want above 120 degrees. So okay, there's gonna be several exercises coming, and I'm gonna walk you guys through all of them. We're not gonna do all of them, but I'm gonna explain the process behind each one. And we're going to go from generally more easier exercises to more difficult exercises that are all going to be accomplishing the things that we're talking about in the last slide. So this first position is really good for someone like a wide, because this is going to provide lateral compression. So basically what this entails is just lying on the ground. And then I like to just have this person do a couple of passive and active tilts, meaning that they're just feeling out what it feels like to go in and out of extension. Because if this is the exercise I'm using with this person, they're probably secondary. They're probably not primary. So they need to feel things out a little bit. And then I'm going to reach for the wall with my palm down, and that's going to help me compress laterally more, which will expand me on my bottom side the most. So here I'm going to get a lot of left side thorax expansion. You can passively hold an object between the knees. This next one right here is a hook lying position. These are all things I'm sure you guys have seen before, but they work very well. So this little drill right here, I don't know if you guys have ever seen my Instagram stories where I post a video of someone massively improving their range of motion. I probably just use this drill, to be honest with you, because it works really well. So this is going to help them restore hip extension, and that's going to get them some proximal hamstrings. This is going to give them some upper and lower posterior expansion because of the low angle of the reach with the supinated hands. Now, this exercise right here is, like I mentioned earlier, great for teaching a passive stack. So if someone really struggles to know what a passive stack feels like, then I would put them in this position right here because there's so many references. So assuming my internet's going to work here. Reaching down, this is just tons and tons of ER bias here. I'm feeling my sit bones, and you might look at that. Are you too rounded? Well, no, because I feel my sit bones and I feel my head right there, and I feel that upper back reference right there. So what you don't want to do is that. That's what people try to do, or they jam their head back into the wall like that. That's what we want to avoid. It should be very chill. It should be very relaxed. All these positions should be very chill. If they're trying to treat it like a max strength exercise, then we have a big problem. All four breathing is a fantastic way to get some anterior expansion, because anterior can be really tricky to get sometimes if you're not prone. Some people respond very well to sideline, others respond really well to prone. Narrows respond very well to prone for sure, because that is just the factor of gravity pushing down, which sometimes that's what people need. I find wides generally need something like the next exercise I believe is coming up, but this is really good for narrows right here. You can also place a small book underneath their hand. And what that would do is, if you remember the principles of trunk rotation, let's say they had a huge limitation in right side internal rotation. You don't want to round your back like that, by the way. You put a book underneath the left hand, what's going to happen? Then the spine is going to rotate to the right because they're offset like that. So their trunk is rotating to the left, which is going to turn their spine to the right. And then they're going to get more expansion on their right chest wall because the muscles on the right back are going to be in a shorter position than the muscles on the left back. And then the right anterior rib cage is going to get more of that expansion. Little trick there. This is not the one I was thinking of. This is crab positions. Crab positions are fantastic because they're going to open up the manubrium, the upper T2 through 4 anteriorly. Because the shoulder blades are being squeezed together, you shouldn't be actively trying to do it. You should be just trying to, keep yourself in that humeral extension, shoulders out of ears. That's going to drive expansion in the uppermost rib cage. I would not do this exercise right away with someone on day one. This is harder than it looks, but this is a great warm-up activity. And I would just hold a passive, very static version of this if I wanted to get that upper expansion. And you're also going to get posterior expansion below the level of the scaps, because think about what gravity is doing and where the scaps are. Okay. This is the one I was thinking about. For wides, I'm putting this all day, every day in that powerlifting ebook that I'm coming out with, if you guys have heard about that, because this is so good for people that are highly compressed and really use a strong rectus strategy. So I'm going to supinate to drive more ER bias, and then I'm going to reach up. Gravity is going to compress me and push down. And then I'm going to also have those obliques on. I have no choice. And then I'm going to get a lot of anterior and posterior expansion on the bottom side here. So that would be my left side in this instance. So this is honestly a go-to one for me. Quadruped inverted breathing. And technically, if your hips are above the level of your head, you're in inversion. It really is that simple. You can just tailor it to the individual and how much shoulder flexion they have. So for example, if this person didn't have 100-ish degrees of shoulder flexion, then I probably wouldn't do it with them, because the higher you get, the more shoulder flexion you need. And then they can start to kick on other muscles that we don't want on in this position. But notice how he's not overly rounded. You see how relatively flat his back is? I mean, he's definitely not extended, but he's not as rounded as some people think these exercises should be. So just make sure that you're cueing a slight retraction and you're just cueing a slight tuck. That's going to make sure that the sternum doesn't depress. They don't round everything too much. This is another very good one to release some concentric lats. So again, because of that height right there, I'm in inversion. And because of the angle of my humerus, I'm going to really be getting some upper expansion here. Would I do this with someone that didn't have a decent degree of shoulder flexion? Probably not. But again, notice how I'm not overly extending. And then I'm going to also turn my head to the same side, if you notice that, because remember, as we get overhead past about 120 degrees, we have that same side cervical rotation. So if I have my right arm overhead, my cervical spine slightly turns to the right. So I can eccentrically orient that neck even more by turning my head, assuming I can keep my shoulder out of my ear. The drunken turtle, I actually took Zach's video for this because I want to give him credit, because I didn't invent this exercise at all. And I think he's really good at it, and I'm wide and I'm really not good at it. So this drill right here is really good for your narrows who have flat backs, really good for those who have a lot of posterior compression, and really good to really make sure that they can sense the ability for them to really just this is kind of like a foam roll in a way. It's kind of interesting. But I think this is a great choice because of gravity, because of the degree of hip flexion that they're in. And also you can look at their reach. I would honestly probably hug a little bit lower to get more of that low humeral reach. He's kind of at 90 right now, but honestly, it doesn't really matter that much because he's going to be getting a lot of low posterior expansion here. And then this is something I've been using a lot more recently with a good bit of success, because this drill is getting people alternating in nature. And this is the point at which I want to hit this point. This is very, very important. If you don't take away anything from this presentation, take away this. If people are really compressed, getting them to do bilateral things and trying to get expansion bilaterally can be very difficult. So doing unilateral things that are alternating in nature are going to give you better results most times, because you're compressing one side, which is what that person likes to do, but you're getting expansion on the other side. So this is a perfect example of some way you can do that. So they're going to get compression that they love, but that's going to allow them to open up and expand on the other side. Low reach, hip flexion. I'm going to have that foam roller underneath to make up for the lack of hip extension this individual probably has. If they somehow had full hip extension, I'd take the roller away. And then I'm going to reach, get a nice strong inhale, long inhale. I'm going to feel my back expand here. So what's really important with this is that their ribs don't come up when they inhale. I'm fine with my neck coming forward. I'd rather, if you guys know what a zone of apposition is, I don't use that term, but the ability to keep those ribs down upon inhalation, I'd rather them be able to do that than any consequences of them potentially kicking on their neck a little bit. I'd rather them be able to get this. This is a different variation, but probably a little bit more engaging for those who like to lift heavy weights. It's an arm bar. So this right here, again, if that hamstring comes off the ground, I know I'm cheating. So we want to make sure that we're really not coming back too far. Some people will feel a hip flexor cramp on this because they don't have the hip flexion or contralateral hip extension. So what I'm going to do in that instance is just place a yoga block in between their elbow and their knee. And then that makes up for the lack of ability to connect, but also it doesn't tempt them to try to go further than they should. We don't want them feeling much hip flexor here, if any, really. That's what we want to avoid too. You see how that crunch, head's got to stay back here. This is another one I've been using more and more. This is going straight in the powerlifting ebook, and it's going to stay there for eternity because this is one of those alternating expansion and compression drills. Powerlifters are super compressed, so they don't know how to bilaterally expand. So notice how I'm right here, low reach, supinated, so I can get some posterior expansion. I'm gonna hold this as I inhale. I would honestly probably just do the static version of this first. So I just hold this position for 5 breaths. I'm feeling a ton of abs on my ipsilateral side I'm pulling to, and a ton of adductor. This is one we're gonna do later on. And then you're gonna feel a big stretch in your contralateral upper back, but it's misleading because you're getting the expansion in the same side upper back. Think about what's happening. If I have my right leg's forward here, I'm turning my trunk to the right, so my spine's going really left. So then I'm getting a ton of right side posterior expansion here. This exercise improves shoulder flexion across the board more than any other exercise I use, generally speaking, with most people. There are exceptions. And then we can start to get into some actual weighted stuff. So just a heels elevated banded goblet squat. The one thing I want to drive home here is the knee should stay in line with the toes and the band resistance should not be heavy. If you're using a black band and cueing them to spread their knees like a power lifter, they're going to kick on your glutes concentrically in a part of a lift that should not be concentric. The knee should stay in line. All this is doing is providing a reference for them to just get into counter nutation. That's all it is. This is not to get glutes. It's not to do anything that most people traditionally think it's for. It's just to serve as that reference. So if the glutes are on way more than they should be, then it's probably a problem. You could also do a front heel elevated split squat. I'm using a contralateral load. I'll talk about that next week, but I just want to start getting your guys' brain churning, just thinking about like using exercises as correctives too. You know what I mean? Not just, getting people on the ground and breathing all the time. This is really good to bias heel strike, really good to bias a little bit of ER because that tibia literally cannot go any much further than it is right there. So I'm going to be really spending a lot of time in heel strike. Now, after that, we're going to go for more of a compression and more of a nutation bias. So at this point, we should have cleared the lower rib cage, T5 through 7. And generally when you do that, you're going to clear up the other thing too. So if I'm, for example, on phase 1, clearing up anterior expansion for that wide, then by now they probably have full ER too in this one. So now I want to make sure I can get that more upper rib cage expansion. That would be more shoulder abduction, shoulder adduction. I don't have shoulder flexion on here, but you could think about getting a little bit more there. But I think that will come naturally as you get more adduction. That's why I didn't include it. And then again, you want to make sure that the left AIC is still kind of falling into place here. The obers, you want to pass the right side. And I thought about this for a good 10 minutes. I was like, do I say the left side has to pass? And I eventually went with no, because if the left side doesn't pass and the right side does, then we know that we're in a left AIC position and it's not the end of the world. But I will say that you can probably get the left side to pass. It's just that, let's say you're table testing and the right side's fine and the left side gets stuck halfway down on the obers, then it's okay. I'm not going to be too worried. And then the straight leg raise should be good, better on the right than the left. And the toe touch should also be full at this point. Okay. Example phase 2 exercises, 90-90 hip lift with a ball hold. I'm not actively squeezing it. I am passively holding it there just to open up and spread apart my pelvic floor. And then I'm going to reach whatever, the reach doesn't really matter here. It's really whatever you're going for. So here I would probably do a low reach if I wanted to restore a little bit more upper expansion here. And then, yeah, I mean, I don't really use 90-90 hip lifts a lot, to be honest with you. I find that it's kind of a difficult exercise for a lot of people, and it's oftentimes a lot of work for someone to get there and feel it. But it's an option. Isometric 90-90 supported hip shift. This is really good because it's going to be just forcing them basically into internal rotation. So they really don't have a chance but to be into internal rotation here. So what I'm going to do is I'm going to see how I turn my hip into that front leg and do a hip shift. Okay. Whoops, that's my intro. Look at what I do with my pelvis. Turning it in, my adductor's on, and I got my glute in the back pushing me into that right side. I'd probably do this on the left if I wanted to clear up a left AIC pattern, but this was just the angle that worked best for the camera at the time. So this is going to help restore pelvic internal rotation and femoral internal rotation, some nutation mechanics on the stance leg. If you wanted some extra juice, you can lift the other leg off the ground. That left leg could come off the ground. And that's like a real ISO right there. This is the only one that's a crappy video, crappy quality. But right here, we have a couch hip extension with a ball hold to bias that nutation. You can't even see the ball, it's funny. And then this is difficult for beginners because this is requiring end range hip extension, which most people do not have. So I would not do this on day one with someone in most cases. But because of where my scaps are, where my reach is, I'm going to be getting a lot of low posterior expansion. Following that, we can do a supine inverted triceps extension. This is going to be great for driving air posteriorly and also in the upper rib cage a lot. So I'm going to be getting alternating pumping of the rib cage, and it's really easy for people to want to overextend here. So again, got to make sure that you have a pretty straight line from your knee to your hip to your head. But if they can't get their hips up that high, then just meet them where they are and make sure that you're driving end range hip extension, whatever that is relative to them. And then you're just getting that alternating pumping, inhaling as you're going back, exhaling and coming up. This is also a good accessory exercise. You could do this with more weight.
I have a quick question.
Yeah.
What are you supporting yourself with? It looks as if you're supporting your upper thorax with just a folded towel. Is that correct?
Yeah, so I've got, that's actually, thank you for reminding me of this. I have a YouTube playlist of all of these exercises, and I believe in all of them but two, I walk and talk you through all of them and give you instructions. So you're free to use them with your clients, you're free to take them and do whatever. But ultimately, to answer your other question, I have about 6-ish inches of comfortable elevation. Some people use a Bosu ball for this. Some people use yoga blocks, but really whatever's comfortable. That's why I have a towel. And I think that's like a little raised block there, that black thing that blends in with the floor. And the head should be able to comfortably rest on the ground there in a neutral position. Now we could also do a goblet squat with the ball between the knees to a 90-degree box. This is about as compressive as you can get with a goblet squat. So I don't really care if you hold 2 kettlebells, whatever you want to use really. The load doesn't matter. In this example, I'm just worried about right here. So notice how it's a light tap. They're not trying to like fully sit down necessarily. You could have them do that, but just to maintain the integrity of the position and stack, I generally don't do that and I cue a light tap. You could also do a front foot elevated split squat with a forward hip shift, contralateral load for even more. And this is going to bias that 90 degrees of hip flexion zone, which is going to bias internal rotation maximally, which is going to get hip internal rotation restored on that left side in this instance, and femoral internal rotation. So I'm going to be getting a lot of concentric adductor. Another thing you could do is a split stance deadlift with a back toe elevation. Now, this is what some people like to call a Camperini deadlift, but there's a lot of different ways you can do this, and we'll talk about all of those next week. But what this does is it allows them to shift into that side. I'm biasing mid stance and internal rotation with that toe elevation, and I'm going to be getting a lot of that nutation on that back leg. So my pelvis is really going to open up like that on my right side as I go into that position. Okay, and then in phase 3, at this point, they should pretty much just be a left AIC. They should pretty much just be where a normal human is. So what I'm going to do at this point is try to do all the things we talked about in week 3 for the rib cage: right expansion, left compression on the anterior rib cage, posterior rib cage, right compression, left expansion. Pelvis, I want to bias more late stance mechanics with the right foot. And on the left, I want to bias more mid stance heel strike mechanics on the left side. And then I can't really give you, firm numbers because everyone's different. Maybe a 21-year-old, athlete guy can pass all these tests in his off season. But maybe if you've got a 68-year-old person who's had 3 knee replacements, they're not ever going to get fully there, and that's okay. So just as some examples for exercises that I really like for this, I'm going to be doing a lot less corrective exercises at this point in the program because they're just a normal human and most people are out of pain by now. Or just their movement is so much better and I'm not really worried about it. But if I did want to help restore a little bit of symmetry, this is a great way to do it. So I talk you through it on this exercise right here, but essentially I'm just biasing myself into mid stance like mechanics on the left side, and also on the right side, I'm going to be getting more of that expansive mechanics. So here I should feel a big stretch in my right ab wall as I exhale, feel these left abs, and then hold that as you inhale. And you should also feel adductor on the left side as you pull that floor to you. Another one you can do is this prone right propulsion, probably better for your narrows than your wides right here because it's prone. So here, notice how this is a little bit of a tricky setup, but I find getting someone to get right glute max, left adductor, right trunk rotation, that's a lot. So just putting them there with all these constraints is a great way to do it. Right hip is extended. I'm pushing into the wall with my arch and getting my right glute. I'm dropping my right hip slightly lower than my left hip so I can get my adductor to come on. It's like I'm doing a hip shift almost. And then I have that block underneath my right arm because that's going to be biasing me into more right trunk rotation. So this checks all the boxes right here.
Connor?
What's up?
In this last exercise, when we did the left AIC, you showed us this exercise when you're doing like a 90 right reach and then a low reach with the left, right? And here is like the opposite. Right is low, I'm reaching with my left and my right is like higher.
Yeah, that's a great question, actually. Thanks for asking that. Okay, so this is one of the things I've actually learned in advanced integration. So I think we know this, but we have to frame it right. So right trunk rotation is necessary to counteract the left trunk rotation in the left AIC position. We can do that through literally placing ourselves in right trunk rotation. Okay, that would give us left obliques. That's the literal way to do it, right? The other way we can do it is position ourselves in a manner that allows us to get right anterior chest wall expansion and left posterior chest wall expansion. So if the targets, because remember, I'm at my left AIC right here, hugging my right side, left is open, this is compressed, this is compressed. So I could breathe in here, breathe in my left back, I would be more neutral. So for example, with a right arm reach, you see a lot of right arm reaches in PRI because what is this doing? I'm at 90 degrees. I'm getting right chest wall expansion because of the angle of the reach. So I'm going to be getting an anterior expansion. So to go back to that all four breathing example that I used when I was quadruped, and I could say you could put a book underneath the left hand, that would be a right arm reach, but I'm getting left posterior expansion, right anterior expansion. So I'm evening myself out. So it's a right arm reach, but what's the context of it and what are you trying to accomplish with it? So with that right arm reach, I'm actually getting the things that are going to allow me to counteract that left AIC. Does that answer your question?
Yes, but here is the opposite. That's what confused me.
So you're literally placing yourself in right trunk rotation in this instance. So in this, you still need to train right trunk rotation. You know what I mean? So you still need to do it. And this is one way to actually get there. This is just the exact opposite of a left AIC. So
Okay.
I should feel more left obliques than I do right obliques because I'm in this trunk rotated position.
Okay.
All right, that's a good question though. I'm sure other people had that as well. I would use this more for a wide because it's side lying and more of that lateral compression. So this is tricky. This exercise is, I don't really like coaching it because it's really hard for people, but once they get it down, it's really, really effective. So the first thing I cue is to push the bottom hip, left hip, greater trochanter. I'll have them palpate it and push it into the ground. That's going to create some space between my left abs and the floor, and I keep my hips tucked. Then I drive my right arch into the wall and I drive my right foot forward, and then I try to pull my left knee up without losing my left heel reference. There's a ton going on here, like a lot, but it's also a great exercise if you want big bang for your buck and they're ready for it. And then you can also push into the ground with your right palm to create some leverage, to drive your foot into the wall and forward. This activity right here is also a little bit complex. You can see they're getting more complicated as we start to get further down. Now, this right here, people will oftentimes have a very hard time feeling their left anterior glute med. That means it's the most sort of like forward portion of your glute med. Now, that muscle is very important because it secures you into left mid stance. But people will always feel their TFL. Not always, but they oftentimes feel their TFL. So if they feel their TFL, which is right next to their glute med, they often confuse it for the same thing. So I make sure people understand that the TFL is sort of on that. If you palpate, I say, feel this bone in the side of your hip. Is it right there or is it behind it? If it's right here, then we know we got the anterior glute med. If we feel this, then we know it's the TFL. So I'll make sure they know the difference there. And this is only if I know I need to get this muscle, which, let's say the context for that would be there's someone who's in a left AIC, they can't get into their left side, and I've gotten their adductor to work just fine, I've gotten their obliques to work just fine. Things check out, but they just can't secure themselves in their left hip. I know I probably want that anterior glute med. So I'm going to use an exercise like this to place the hip in extension. So I have a straight line from my left knee to my left hip to my head. I know you can't see that, but it's hard to film this one by yourself. So I'm going to push down on that object. Ideally, you would have something that allows your hip to stay in line with your knee, like a big med ball. And then you're going to turn your toes down in internal rotation and then lift up. And that's going to give you anterior glute med. This is my number one TFL inhibitory technique because this places the TFL in a position where it's very hard to get it to actually work. And finally, if you want something more upright, the upright runner is something I think is really great. You guys have probably seen variations of this in the past, but this is basically just an upright right glute max activity. So I'm reaching down, left mid stance, right late stance. Okay, so I just gave you guys a lot of ideas there for exercises that you can do. I'd rather you eventually get to the point where you can just come up with something if you need it for someone. If you just memorize all this stuff, you'll have a lot of success, but you'll eventually reach a point where someone is not what you expected. And it's hard for you to find the right one out of all the ones I provided for you right here. So if you can think about the principles, which is more important than just memorizing all these exercises, you're going to have a lot more success down the line. But it's totally okay to start off just by using these. That's totally fine. Just to summarize this portion of it, a few notes. Most people don't want to do a lot of correctives. So I try to minimize it as much as I can, but I think I'm also at a benefit with the people I work with because they expect this kind of thing. Whereas if you're someone who works at a gym where people aren't necessarily coming to you with movement restrictions and that's their primary goal, they're not going to want to do a lot of this stuff. So I think next week's stuff is going to be more applicable, but this stuff is massively important and we can't skip it because this provides the context for them to go and own the positions in the weight room. And I also hit number 2 already. And then number 3, I think these are best used as a warm up or, you know, more than 1 or 2 of these when they really need it. Okay, let's talk about some pelvic orientation fixes now. We talked about these in the compensations week. So let's talk about what we actually do to resolve these at this point. Okay, so the first one was the sagittal orientation. To review, the sagittal orientation is when you get pushed like this. You get pushed like that. Now, it's often, all of these orientations are often just a result of this individual trying to find right hip internal rotation, or they had an injury to the right side of the body and they shifted back over to the left, but they want to get back in the right. There's a lot of different ways these things can happen. So the first thing we want to do is pull them back to the left with a left hamstring. We want to get that pelvis, which is often forward already, and push forward even more. We want this hamstring to pull it back. And we can do that with an exercise like this 90-90 alternating crossover. Something as basic as this right here. This would work. And then something like a hip shift activity. So they got it back. Now we got to get in it like that. So an adductor pullback would be an appropriate activity for that. And then dynamic split stance activities after that to then go and be able to dynamically do these things instead of statically. So that would be something like right foot forward chops and split squats to push out of the right and into the left. So I would go in this specific order, but again, this stuff doesn't really matter until you clear them bilaterally. So clear them bilaterally first, do phase 1, maybe do phase 2, and then see where they're at after that. The next one is the lateral orientation. This is the one where they have the pelvic hip hike on the left. So they're here and here. Now, this individual needs to push back to the left. So they need their right glute to do this. Push them back to the left because they're here. That right glute needs to come basically forward and up like this. Needs to go. That right glute needs to push them back to the left. So if they have less than 90 degrees of hip flexion, we're going to do the left sideline right glute max because they just don't have the ability. Oh no, it's more than 90 degrees of hip flexion. My bad. Yeah, more than 90 degrees. Yeah, that makes much more sense. They're going to be doing the left sideline right glute max because they have the hip flexion to actually do it. If they don't have the hip flexion to do it, then something like this would be appropriate. Then we want to have dynamic activities with the right foot forward again to help get them that propulsive right side to push them back into the left, but more dynamically. So we can do this with step downs, rear foot elevated split squats, right arm cable presses, things like that. Finally, we have our oblique orientation. With this one, it's quite similar to the first one. So we're going to want to pull to the left with our left hamstring and adductor because this individual is here on an oblique axis. So we want them to pull this down and then that right glute pushes them forward. So notice how really with the first and last, with sagittal and oblique, we want to get pulled to the left. With lateral, we want to push to the left first. That's the important distinction. And then we really want to get these left heel strike activities done. We want to make sure that we can bias them towards, let's say, heel elevated split squats, deadlifts, things like that. Does anyone have a question on the oblique orientation or any of these orientations? Okay.
I actually do, Connor.
What's up?
When I was reviewing the orientations, I had a case where the guy had a left hip hike, but in the rib cage it didn't match what you posted. So I was confused. Like, can I have like an orientation in the pelvis that is not affecting the rib cage?
I mean, all of these orientations will necessarily affect the rib cage because you can't separate the two. But really, if you clear the rib cage, like that's why I say clear them bilaterally first, because if you clear up the rib cage, then you're often going to have the pelvis clear up to some degree as well. But if you look at, let me see if I can just pull it up for you guys really quick. So does this answer your question right here? If I were to show you from the pain and compensatory patterns week, what's going on within the rib cage itself in those measurements? So for example, the left shoulder flexion is better than the right in this right oblique orientation. So what that means is that they're actually rotated to the left. So what I mean by that is this. So right pelvic orientation here. And what you would expect because of the right hip hike in many cases in the normal FDIC, you have the right shoulder flexion that is better. But this is essentially now flip-flopped and now you're here. So the left shoulder flexion is now better. So you will have for sure things that affect the rib cage. And that's why you need to check all of these distinguishing features boxes before we can say, okay, this is definitely an oblique orientation, because there are similar differences. But I would say the oblique one is going to change a lot of the rib cage, and so is the lateral orientation, because this individual has, that's not.
So this guy in particular he had a left hip hike, but the right shoulder flexion was better. So that was, and he had a presentation like the left shoulder was higher. So like a left AIC, but with a left hip hike. So I was like,
yeah, I would say, did you clear that person bilaterally first?
No, this is the first assessment I do with him.
First assessment, yeah. So I think that's a good example of someone who probably has an orientation issue, but they have a bunch of stuff piled up. So I think if you were to clear him a lot bilaterally and see what you can get to restore, you're going to see more of a specific assessment to one of these things, or you see just things get better on their own. That's why I think it's important to do that first.
Okay. Thank you.
Mm-hmm. Okay. So back to some actual example progressions here. So this is a made up person. I'll get into actual real case studies in a couple of weeks here, but let's say this is what I saw in the assessment. Narrow with secondary compensations. I won't read that whole assessment, but I would get them the phase 1 exercises, get them in something like a quadruped position, inverted, because that's going to allow them to get that upper expansion. Narrows tend to respond really well to inversion. Hook lying hamstring bridge to help them get out of some of that anterior pelvic tilt that they have going on. They're in secondary compensations. And then single leg stance alternating chops to help them get some of that lower and upper posterior expansion back. I'm just going after restoring hip flexion, abduction, external rotation within the pelvis and thorax. And then side lying adductor pullback on phase 2. And isometric 90-90 hip shift, front foot elevated split squat with a forward hip shift. And then by phase 3, I'm not doing that many corrective things in nature, so to speak. So I would just maybe throw these 2 things in within their warm up and call it good. Why do I say with secondary compensations? This is someone who passes their right obers, but fails their left. So their pelvis really isn't that crazy, but their upper body for sure is very limited, which is what you often see with wides with secondary compensations. So I will start them off with 90-90 hamstring tilt sideline, all 4 breathing to restore some internal rotation, and then the supine alternating cross connects to help them decompress all this tone they have going on within their back. Couch hip extension. After that, to restore some more in-range hip extension, supine inverted alternating tricep extension and single leg banded stance chop, or single leg stance banded chops. And then left sideline right glute max, and then finishing up with an upright runner again. At that point, I'm probably just throwing those in within their warm-up. Hopefully that makes sense. So with some people, and I would feel irresponsible if I didn't tell you guys this, that 10% of people I work with don't really see any progress. And I think that'll be the case for many of you as well. because people have a lot of other things going on in their lives, and it's outside our scope of practice as trainers. A lot of people have cranial things going on. A lot of people have dental things going on, which really does matter. It makes an immense difference. Vision problems, trauma from childhood, and just overall not complying. Some people just won't do what you tell them to do. And then you can kind of cut the cord if you want, but there will be a degree of people who won't get better, and that's just okay. Those people we refer out. If we have athletes, it's always the question, right, of like, how far do we go with these people? Well, if they're utilizing their pattern and extension for their sport, which a lot of athletes do, I'm going to be okay with them doing that. I don't want to take them totally out of their pattern in season, especially because if I did that, then they would probably become a worse athlete. But if they're a terrible athlete and they've got nowhere to go but up, really, then I'm probably going to be less weary of taking them out of whatever pattern they have, because their pattern is just, they're not a good athlete. So if you teach them a new pattern, how to, be a better athlete in that pattern, then you're probably going to see more success. Within the off season, I'm going to restore things more. I'm going to pass all the tests to a realistic degree. So for example, this 100-meter sprinter that I had. He was a really good athlete. He was one of the best sprinters for his age in Texas. And look at him. This is like after we were done working together. A little bit of an anterior pelvic tilt, nothing crazy, it's better than it was, but he's got a lower left shoulder than his right. He definitely has some compensations going on, but I was okay with it because I didn't want to take him too far out of where he was, and he didn't have any issues. So really at that point, why bother? In season, we wanted him to basically stay in his left AIC pattern, or his underlying left AIC pattern, I should say. Squat, get to about 110 degrees of hip flexion, toe touch mid shin, just stay compressed, dude. Like that's all this was just, okay, you're compressed. Let's keep you that way, but let's also make sure, you can access some degree of expansion. And let's make sure you can get out of this extension that you love to be in. It's going to be different for every athlete you work with. So I can't say, tennis players should have this, and it's really individual. Now, finally, lifestyle factors. I'll get into this only if I'm not seeing progress with someone and I know that they need a little bit more things to think about at home, because the whole idea of the exercises is to put them in a position where they are unconsciously competent. Those were the words I was looking for. So if that person can do an exercise, they should be able to get up and not have to think about it. Their body should be in the position. That's why these exercises have so many things going on, because we're working with a lot of different systems of the body. But if they're not seeing any progress, they're probably just doing the exercise and then getting up and defaulting back to where they were. So I will cue them if necessary. If you're going to stand, feel your heels, feel your whole foot down, but I want you to really feel your heel, and I want you to keep your ribs down. Maybe unlock your knees a little bit. If you're going to sit feeling both sit bones, maybe your left foot behind the right, if you're really buried in your right side, and feel your heels firmly on the ground. If you're going to cross one leg over the other, have it be the right over the left. I don't really use that one that much, but you could if someone's just, again, buried in their right side. That's a PRI one more than anything else. Sleep with a pillow in between your legs and underneath your waist. So that will even out your spine. So if, for example, you sleep on your left side, then that's 8 hours. I'm assuming you don't move. That's 8 hours you're spending basically expanding your left side with gravity. So if you can even yourself out like you are in that picture right there, then you're probably going to have a more even spine, more even expansion at rest. And then if you're going to stand on one leg, stand with your left behind your right and your pelvis facing left. A lot of people will hug their right leg when they stand. So if they can get on their left side and then still have their pelvis face left, that's good, because you can stand on your left leg and still have your pelvis face right. But we're trying to get people into this more. And again, I'm only going to use these if I have to. It's just good information to have. It's not necessary. All right. I feel like that was a long one. What time is it? Oh, it's only an hour-ish. Any questions on any of this stuff? I want to take you guys through a couple of them, if you're okay with that. Let's do this one. So you don't have to have your foot up against a foam roller, but it'd be great if you could have it up against a wall. So here, let's do this first. Let's take our shoulder flexion assessment. Let's lay on the ground. I mean, you're gonna be laying on the ground anyway. So let's just get on the ground and then do your overhead shoulder flexion. See how much you got. Keep your elbow pointing perfectly straight ahead and make sure that you're not letting that elbow deviate outwards or you're arching your low back. Get an initial assessment. And then let's do this drill. So what I want you to do is lay up against a wall and then drive your bottom heel, whatever one's staying on the ground, into that wall and pull your other leg back. That is going to basically keep you in hip extension on your down leg, hip flexion on the other leg. Now reach low with your elbow and try to meet it in the middle. If you can't, that's okay. You can crunch a little bit, but you want to go opposite arm, opposite leg. And you want to make sure that you're exhaling as you reach and then hold that as you breathe in. You should feel stretched in your upper back as you inhale. And then hold that position for 5 breaths. Just hold it. You don't need to alternate necessarily. Inhale, exhale. Good, 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 good. Full inhales, full exhales. And then do your other side for 5 breaths. Make sure you're keeping your ribs down as you inhale. Oh, we have a lot of chat messages. Good. Now retest your shoulder flexion after you did 5 breaths on both sides. It should feel easier. Raul, you seem to get a little bit better.
But this one is really hard on the abs.
Yeah, it is. Yeah, it is.
Hard to hold it.
It's a good one.
It's really hard for the abs. Wow.
Yeah, dude.
Can I ask you a question?
Please.
So I'm in my bed here. So when I have my, sorry, you can't see it. When I have my right heel pushing into the wall and coming up like this, is it also my right abs if I'm correct?
Good question. It should actually be more of your left abs.
Yeah, because I'm compressing, yeah, here. All right, cool. I was just,
That's
thank
a
you.
good question though. Yeah, I could see how you would think it would be the other way. Okay, any other questions on that one before we do another one? Okay. Let's see what other one we want to do here because we don't want any equipment. Let's do, let's see. Let's do this 90-90 side plank. Take an initial internal and external rotation measurement of your, do your right side because generally you're gonna have worse right internal rotation. So get one of your right side, see where your IR is at. Make sure that back shoulder is not coming off the ground. And then get into a side plank on your right side, supinate that hand. And then hold that for 5 long, slow breaths. Make sure that your hips and knees are bent at a 90-degree angle. Like that. You're driving through your bottom side knee and your forearm. So I think everyone here could pretty much afford to bend their knees a little bit more. Pretty much everyone here. And then your eyes are looking up at your fingers there. Inhale, exhale. Feel like your bottom oblique is like a rainbow. It's like an arch. Keep those hips tucked. Full inhales. Good. And then retest that shoulder internal rotation. Should got maybe 10, 15 degrees better. If it didn't, maybe it's not the exercise for you, but I'm seeing like people, we're seeing some good improvement. I'm seeing. Nice, nice. Okay. Now, another one. Let's do the prone right hip extension. You don't really need to get all those books and blocks out. Let's just do it without, this. So you still can. Just place your knee on the ground, both forearms on the ground, and let's get in this position right here. This one should restore some internal rotation as well because of the prone aspect of it. So your left knee's bent at 90 and your right hip is extended back on that wall. You can have a slight bend in your right knee. I'm usually okay with that. Whatever helps you feel your right glute more. And then make sure you keep your hips tucked. Drop your right hip and try to almost hip shift into the left, and that should give you some left adductor for sure. If it doesn't, let me know. Now push the floor away slightly with your elbows, and that should bring your ribs back. And breathe in that position for 5. You should feel right glute, left adductor, maybe a little bit more left abs and right abs. Full exhales, full exhales. Looking good. Retest your internal rotation of your shoulder after that exercise. That should feel easier because you're prone. All right, any questions on any of this? Do you guys want to try any of them? While I wait for questions, I'm just going to scroll through this a little bit. If you guys see anything you want to try, let me know.
Hey, Connor, how hard should we be inhaling and exhaling?
I say the longer, the better, and the more relaxed, the better. Okay. So yeah, I make a big point of that to people. It's not force, it's duration.
Okay, cool. Because some of these are actually these are pretty hard.
Yeah, yeah, they are. Yeah.
Okay.
Did anyone not get any improvements? Did no one's measurements improve at all?
No, I had the same question as Ryan. Like these exercises that are so hard, I don't see like I can get like a parasympathetic state doing the exercise.
And it's too hard for you. I mean, you should be working, but I remember seeing you do your assessment, Raul. You remind me a lot of myself. I think I wouldn't put you in that hard of a position to start off with. I would not put you in that prone right hip extension exercise. I would put you in something like this, something maybe even, I think this one would be appropriate for you too, actually. So those are the types, lots of references. And yeah, they're hard. I mean, that's better than it being boring, right? I guess. But most people want to feel like they're doing something. So I like to pick positions that allow people to sense that.
Connor, I get a question.
What's up, Perry? Perry? Is it Perry or Perry?
Sorry?
Sorry, go ahead. You're a little
okay.
bit staticky. Go ahead.
Okay. So if we work with people who who cannot get into certain positions, such as prone, for example, for very old women, and we change the position of the body, but we keep on addressing the same muscles. I mean, for example, instead of doing this quadruped with the right leg reaching to the wall, if I do that standing in such a way it's more comfortable for them, do I get the same result or not? Or because of the position, it's gonna influence the air where it's coming and so on.
Yeah, the position is going to dictate where the air goes. So you can cue certain things in certain positions to get what you want, but I think I'm just going to pick the easiest bang for my buck. So I'm going to go with the position first and let that determine where air is going. And then I will use the rest of the cues to just fill in the gaps, if that makes sense. So I think, yes, you could pick a different one, but gravity, and I keep driving this point home because I really do believe it, gravity is what is going to give you the best result more than anything else.
Okay, because if we work with, for example, certain people with osteopenia or osteoporosis, and we put them on prone position, it's like they are dead, like they're so compressed posteriorly that they feel really pain on that position. And well, if you try to put them on the quadruped, if they are too tense or too weak, they are gonna feel their knees and so on. So it's like, okay, so you got sitting, standing, and side layer maybe to work with them. So that changes a lot the possibilities with this kind of clients. But I know what I mean. That okay, so let's change the direction of the arm. Let's change the direction of the legs, like doing a sideline split squat. I don't know, with the wheel reference, and just help them to feel less tight, right?
Yeah, I think if I have someone who's really broken, then sideline, standing are the two places I'm going to put them. I'm going to do something like this. I'm going to do something like that. Short seated too. So yes, I'm going to put them in positions that are 100% safe for them, because you're right. Your options are limited when you have someone that's that really just broken, for lack of a better term right now. But yeah, I think you're on the right track. Put them in something like this. Put them in something like this to start, and then see where you can go with that. Because if you put them anywhere else, you're not going to get anywhere, because they just literally cannot handle it.
Yeah, and they go into sympathetic, so it's impossible for them to apply the exercise. And another question was, yeah, with the cube breathing, normally I, for example, for squat, yeah, we all know that we inhale, then we exhale as we raise up, okay? Depending on the weight we are working with, then we add an apnea in order to maintain intra-abdominal pressure. But you know, it's when I work with a 90-year-old grandma, okay, and it's like, okay, he first started with apneas for just raising up for a chair, and now he can keep on breathing. So that's a very good improvement. Also, she is not raising any weight, right?
Right. Right.
And at first it's like, okay, I would like to inhale as you lower down and then you exhale, but for some people that's impossible to coordinate. And I don't know if it's a nervous system issue or whatever, but I just keep them tell, okay, so breathe as you like, but keep on breathing, because when I feel that when we exhale, we we can apply changes to the body. But if we keep ourselves on apnea, that's not possible, right?
What was the last part of that? The last like couple
That
of words?
if they don't breathe out, if they keep on apnea, if they are holding their breath, sorry, while doing an exercise, that's making them sympathetic. So changes cannot be applied to the body, right?
I mean, I think that's tricky. I think if something makes them sympathetic, it's like how much sympathetic, because it's like a sliding scale. It's like a spectrum. So I think if they get a little bit sympathetic and that's all you can do, and that's just what it is, I think that's okay, because the body's still going to adapt if you give it, you know, something to adapt to, a threat to the system. So I guess it depends, like, what are you going for? But if you're going for total relaxation, then literally just having them learn how to breathe, you know, just standing or sitting down in a chair could be a good first point, and then go from there. Something we talked about in advanced integration a lot was that the inhale is what treats, quote unquote, the person. So a good exhale is cued because the inhalation is what's going to give them that expansion. So I think if you set them up for success with a good exhale in a position that's totally non-threatening, you're going to be just fine.
All right. Thank you very much.
Mm-hmm. Anything else? All right. You guys want to do any of these exercises? I recommend. Oh, go ahead.
So I work with powerlifters a lot, and so I'm pretty excited for your ebook that's coming out. And you mentioned with that, I think it was like one of the cable rotations that it would be your go-to, especially for someone who's wide, to improve a lot of different measurements. What would be your sort of lower body equivalent for maybe someone who's really compressed on the posterior aspect of the pelvis? Because a lot of the times, like the way Pat Davidson has described it to me is like, if someone just like punched you in the back of the butt or like in the back of the middle back, like you kind of just get like turned out like this, which is why you have that like fake ER in the shoulders and the fake ER in the femurs. And I know you've talked a little bit about like a lateral lunge to release glutes with like a shift over the leg. Would that sort of be something that you would maybe think about for a situation like tight glute?
Yeah, I think if someone's a power lifter and they're really compressed, I'm going to want to get them to decompress pretty heavily. So I think honestly, something like this is really good for that. Something like this is really good for that. Let me see if I can find any good. Something like this could be really good for it if you were to potentially hold a ball between the knees. But again, I think getting them to expand is going to be important first and foremost. And usually wides can get a lot of expansion, a lot of their measurements back just by restoring hip extension. I find with wides, that's usually the thing that gives me the most immediate results. So things like this that are going to help them get there, I think are really, really important. And also I find tempo goblet squat, something like this with tempo is really big for them, getting them to squat deep and get into that hip flexion. Another thing that I find works really well is the Jefferson split squats. I'm putting this in the ebook as well. Something like this, but holding the weight in between the knees is a go-to for me. And power lifters, I use that one quite a bit. Hopefully that gives you some things to chew on. If someone, for example, had very, very limited hip flexion, let's say they literally just could not bring their hip back beyond like 90 degrees, then I'm going to go for, let's see if I can find it. I actually don't think I have it on here, but something that's similar to it would be something like this, and making sure that there's a yoga block in between the elbow and the knee. Because if we force them beyond their limits of hip flexion, sometimes they can get issues. But it's also, you know, doing those Jefferson split squats can be a way for them to actually get into hip flexion. So it depends if that's why there's always some guess and check, right? So if that helps them and they can own that hip flexion, I would do the Jefferson. And then if they can't do it, I would put them in something like this and help them get it back over time.
Gotcha. So you think if you restore hip extension and flexion both kind of at the same time, you'll see improvements in IR too?
I would go for I would probably seek to expand them first, right? So I'd probably go for more of, I think, but that's the thing too, because you're just getting their pelvis in a better position. So by placing them in a hook lying bridge position, you're going to be giving them hip extension, but this is also more of a ER biased position because of the hook lying nature of it. So you're just getting their pelvis in a better position, which is going to give them better hip flexion. So they should be able to do this and have better hip flexion afterwards.
Cool. All right. Thank you.
Yeah.
Connor, this question, you mentioned the deficit split squat, but that also biased them to internal rotation and V1 expansion. That confused me, like when to choose what.
So it's just this. It's just this right here. So if you follow this, you're going to see good things happen. So the reason why I was describing why, so for example, let's go back to this right here. So this is technically them training themselves to get better hip extension, right, through the hamstrings. But counter nutation, because of the position, is more of an ER biased position than a 90-90. So I am going to be getting more counter nutation here, but I'm also going to, which is more expansion biased, but because you're getting their pelvis in a better position, you're going to improve their hip extension as well. So I can see how that would be confusing, but just understand, because you're giving them this, you're going to be getting their pelvis in a better position. So then by the time you get to this right here, this phase takes much shorter than this phase most times, because you're spending a lot of time just getting them in a better position, which is going to improve all of the compressive measurements usually as well. So by nature of doing this, you're also going to see some improvements in this stuff as well. Does that help, Raul?
Connor, I got a last question because I'm always asking. When it comes to teaching those exercises, for example, for the 1990 bridge, okay, because that's my top one I use with all the clients in order to restore their neutral position of the pelvis and so on. And I like to feel like, okay, first just touch your pelvis, then add your hamstrings, then add your ball fold,
Right.
then focus on lowering your ribs down. I mean, is that a good manner to use it, or do we have to go directly to execute all the precision points, so to say?
Sorry, man, I'm having the hardest time hearing you. Could you maybe type it in the chat? I think there's just a lot of background noise going on with you, and it could just be my speakers too.
Yeah,
So I apologize about that. I'm sorry. While you type that, does anyone else have a question?
I have a quick question.
Go ahead.
For the band around the knees goblet squat, would you use that to get somebody in, like enough hip flexion to get into the nutation part of a squat, or past the nutation? Like, would you get them into parallel or past parallel?
Past. Because I would want them to expand. Like, I want them to go into nutation when they need to go into nutation, but this is getting me deep so that I can get into counter nutation, which that band is allowing me to have a reference to do that.
And you would use the ball for somebody who can't quite get into the nutation part?
Right. Mm-hmm.
Yeah. Thank you.
Mm-hmm. Anything else? Going once. Barry, I'm gonna assume you're still typing your. How much load is too much for the strength-based correctives? So I would say, like, what I'm putting in the powerlifting ebook is I don't want them going over 75%, which is kind of an arbitrary number, to be honest with you. But I think once you start getting pretty heavy, you start compressing more and more because load is compressive, right? So I would say when I'm giving someone something like this, I'm probably not having them use any more than, well, if this is true corrective, like a warm up in nature, then I'm probably not going to have them use much at all. Like I'm putting a 25, 30 in their hands if they're a guy, if they're a girl, maybe like a 20. But ultimately, I'm not going to ever really give someone more than 75% of their 1 rep max on something like a positional exercise, like really anything we're going to talk about next week if that's not a primary lift. Hopefully that helps, Ryan. But usually the lighter the better, and that really is the honest. Yeah, the lighter the better, really. When it comes to teaching, do you cue all the precision points at the same time? Oh, now I understand. Yeah. So no, I go one at a time. Now I understand what you were trying to say more. So yeah, I go one at a time. I'll say, I usually go sagittal cues, frontal cues, and then transverse cues. So I'll say, okay, I want you to tuck your hips. I want you to do like the hip shift. Like the right glute max is a perfect example of that. So I'll go, okay, I want you to tuck your hips, push your left hip into the floor, get your left obliques. Now push your right knee forward and up and get your right glute, something like that. Sagittal, frontal, transverse is usually good for cues. Or do you use isometric variation of the same FE squat? Are you referring to the front heel elevated or FE squat, feet elevated? But yeah, you could use isos to answer your question. Yeah, you could use isos on any of this stuff. And that would be totally appropriate if that met the goal of what you were trying to do. Like, so for example, you could do it on that right there and just hold that 90 degrees of hip flexion.
I mean, if you are using a certain exercise, but they lose their hip control or the respiration cues, it's like, okay, so stay still and breathe into that position.
Mm-hmm.
And then
Yeah,
add movement posteriorly.
for sure. Yeah.
Okay, that was my question.
Mhm.
Thank you very much.
Of course. Anything last? I'll put the YouTube playlist up when I go and upload this video right after this. So you guys have that. Going once, going twice. All right, guys, thanks for coming. I will talk to you on Thursday. That's when the review session will be. See you guys. Thank you.